Hello everyone. Welcome to the Demography Desk. In today's video, we're going to explore an important topic for those preparing for the UGC-NET Population Studies exam: different sources of data in India. The important sources of vital statistics in India are population census, civil registration system, demographic sample surveys such as those conducted by the National Sample Surveys Organization, NSSO, sample registration system, SRS, and health surveys such as National Family Health Surveys, NFHS, and district-level household surveys, DLHSRCH, conducted for assessing progress under the Reproductive and Child Health Program. A separate manual on population census is uploaded in MOSPI website. This manual deals with vital statistics from other sources. First, we discuss census. History of the census. Ancient and medieval period. Ancient and medieval period. Rig Veda, the earliest literature Rig Veda, indicates that a form of population count was maintained during 800 to 600 BC in India. Arthashastra by Kautilya, written in the 3rd century BC, recommended the collection of population data as a state policy measure for taxation. Ain-i-Akbari, during the reign of the Mughal Emperor Akbar, the administrative document Ain-i-Akbari also included detailed information on population, industry, wealth, and various other characteristics. Pre-independence period. Early attempts. The history of the census in India dates back to the early 1800s, following the commencement of the census in England. As part of this trend, a census was conducted in Allahabad, 1824, and Banaras, 1827-28, by James Prinsep. The first complete census of an Indian city was carried out in 1830 by Henry Walter in Dhaka, now Dhaka. The second census was conducted in 1836-37 by Fort St. George. In 1849, the Government of India mandated local governments to conduct quinquennial, 5-yearly population returns. First non-synchronous census, conducted in India in 1872 during the tenure of Governor-General Lord Mayo. First synchronous census. The first synchronous census was conducted under British rule on February 17, 1881, by W.C. Plowden, Census Commissioner of India. Since then, censuses have been conducted uninterruptedly every 10 years. Major events, findings in India's census. First census, 1881, emphasized the classification of demographic, economic, and social characteristics across the entire British Indian subcontinent, excluding Kashmir and French and Portuguese colonies. Second census, 1891, conducted on a similar pattern as the 1881 census. Our efforts were made to achieve 100% coverage, including the upper part of present-day Burma, Kashmir, and Sikkim. Third census, 1901. This census included Balochistan, Rajputana, Andaman and Nicobar Islands, Burma, Punjab, and remote areas of Kashmir. Fifth census, 1921. The decade of 1911 to 21 remains the only one to witness a population decline, with a decadal decrease of 0.31%. This decline was primarily due to the 1918 flu pandemic, which claimed at least 12 million lives. India's population had been continuously growing until the 1921 census and has continued to do so since. Thus, the 1921 census year is referred to as the year of the Great Divide in India's demographic history. 11th census, 1971. It was the third census after independence. A question on fertility was introduced for currently married women. 13th census, 1991. It was the 5th census of independent India. The concept of literacy was revised to consider children aged 7+ as literate, unlike the 1981 census, which classified children aged 4+ as literate. 14th census, 2001 marked a significant technological advancement. The schedules for the phases were scanned using high-speed scanners, and handwritten data was digitized using Intelligent Character Recognition, ICR. ICR, an advanced version of optical character recognition, OCR, captures handwriting from image files. 15th census, 2011. For the first time, a significant decline in population growth was observed in the EAG states. Empowered Action Group states Uttar Pradesh, Uttarakhand, Bihar, Jharkhand, MP, Chhattisgarh, Rajasthan, and Odisha. 16th Census, 2021. Census 2021 was postponed due to the COVID-19 pandemic. However, it will be the first digital census, with a provision for self-enumeration. For the first time, information will be collected on households headed by a person from the transgender community and the members living with them. Previously, only male and female columns were available.
Socioeconomic and Caste Census, SECC. About the Socioeconomic and Caste Census, SECC, was conducted in 2011, marking the first time since 1931 that such a survey was carried out. It aims to canvass every Indian family in both rural and urban areas, asking about their economic status. This allows central and state authorities to develop a range of indicators of deprivation, which can be used by each authority to define a poor or deprived person. Specific caste name. This enables the government to reevaluate which caste groups are economically disadvantaged and which are better off. Difference between census and SECC. Field of coverage. The census provides a comprehensive portrait of the Indian population, while the SECC serves as a tool to identify beneficiaries of state support. Confidentiality of data. Census data is considered confidential, whereas SECC data is accessible to government departments for the purpose of granting or restricting benefits. Significance of SECC. Better mapping of inequalities. SECC has the potential to map inequalities on a broader scale. It is instrumental in establishing the statistical basis for continuing caste-based affirmative action programs or welfare schemes. Legally imperative. It is also legally necessary, as courts require quantifiable data to support the current levels of reservation. Constitutional mandate. The Constitution of India also supports conducting a caste census. Article 340 mandates the appointment of a commission to investigate the conditions of socially and educationally backward classes and to recommend steps that the government should take. Associated concerns with SECC. Repercussions of a caste census. Caste is an emotive issue, leading to potential political and social repercussions from conducting a caste census. Concerns have been raised that counting caste may reinforce or solidify identities. Unreleased data. Due to these concerns, a significant portion of SECC data remains unreleased or only partially released nearly a decade after the survey. Caste is context-specific. In India, caste has never served as a simple proxy for class or deprivation. Rather, it represents a unique form of embedded discrimination that often transcends class. DLHS, District Level Household and Facility Survey. DLHS, District Level Household and Facility Survey. Initiation. DLHS was initiated in 2007 to assess the utilization and perception of government healthcare services. Survey rounds. DLHS 1. Conducted in 1998 to 99. DLHS 2. Conducted in 2002 to 2004. DLHS 3. Conducted in 2007 to 2008. DLHS 3 coverage. Covered maternal and child health, family planning, reproductive health, and National Rural Health Mission, NRHM, interventions. O interviewed ever married women, age 15 to 49, and never married women, age 15 to 24. Sampling methodology. Rural areas, 2-stage stratified random sampling. Urban areas, 3-stage stratified sampling. Census 2001 data used as the sampling frame. Facility survey. DLHS 3 included a population-linked facility survey covering all community health centers, CHCs, district hospitals, DH, subcenters, SC, and primary health centers, PHC, serving selected PSUs. Questionnaires. Bilingual questionnaires used for households, ever married women, unmarried women, villages, and health facilities. Sample size covered approximately 7 lakh households across 612 districts. Progress. OData collection for 601 districts completed in 2008. OFACT sheets for 599 districts printed. Remaining are under progress. O state-level reports for several states printed. Others are in progress. Dissemination. O preliminary results presented in a national seminar in 2008. O state-level dissemination workshops conducted in Andhra Pradesh and Punjab/Chandigarh. District-level household and facility survey, DLHS 4. Conducted 2012 to 13. Objective: to provide district-level estimates on maternal and child health, family planning, reproductive health services, and health infrastructure and service delivery. Coverage included 336 districts across India. Key features: priority focus, targeted high-priority districts identified by the National Rural Health Mission, NRHM, CAB component. Collected data on nutritional status, prevalence of anemia, blood sugar levels, and blood pressure among women and children. Health infrastructure. Provided district-level estimates on key indicators such as the availability of doctors, nurses, and other healthcare staff. Assess the quality of care in health facilities. Facility survey. Evaluated the availability and quality of health infrastructure, human resources, and services in public health facilities, including community health centers, CHCs, primary health centers, PHCs, and subcenters. DLHS 4 covered 336 districts and focused on high-priority districts under the NRHM. The DLHS series was replaced by NFHS for subsequent rounds, starting from NFHS 4. NFHS, National Family Health Survey. National Family Health Survey, NFHS. Purpose: NFHS is a large-scale, multi-round survey conducted to collect data on population, health, and nutrition across India. Collaboration: NFHS is a collaborative project involving the International Institute for Population Sciences, IPS, India, ICF, USA, and the East-West Center, USA. Nodal agency: the Ministry of Health and Family Welfare, MOHFW, Government of India, designated IPS as the nodal agency responsible for coordination and technical guidance. Funding: the survey has been funded by various organizations including the United States Agency for International Development, USAID, the Bill and Melinda Gates Foundation, UNICEF, and the Government of India. Implementation: IPS collaborated with multiple field organizations, FOs, for survey implementation, with each FO responsible for conducting survey activities in one or more states. NFHS 1, 1992 to 93. Collected extensive data on population, health, and nutrition, with a focus on women and young children. Assisted by 18 population research centers, PRCs. 48 reports were published at the state and national levels. NFHS 2, 1998 to 99. Covered all 26 states of India. Added features on health service quality, domestic violence, reproductive health, anemia, nutrition of women, and women's status. Results were published afterward. NFHS 3, 2005 to 2006. Covered 29 states in India, conducted by 18 research organizations, including 5 PRCs. Funded by USAID, DFID, the Bill and Melinda Gates Foundation, UNICEF, UNFPA, and MOHFW. Included technical assistance from ICF, USA, and HIV-related assistance from NACO and NARI. NFHS 4, 2015 to 16. Provided data for all states and union territories, UTs, in India. Introduced district-level data for most indicators. Expanded scope to include clinical, anthropometric, and biochemical (CAB) testing. Covered topics like sexual behavior, HIV, AIDS knowledge, attitudes, and domestic violence at the state level. NFHS 5, 2019 to 21. Covered 707 districts in India. Conducted in 2 phases with data collected from 636,699 households, 724,115 women, and 101,839 men. Added new topics such as preschool education, disability, access to toilets, and reasons for abortion. Expanded SAB testing, but did not include HIV testing. NFHS 6, 2023 to 24. Currently being conducted under the MOHFW stewardship, coordinated solely by IPS Mumbai. Will provide estimates of fertility, infant and child mortality, and other health indicators at national and district levels. Aims to measure trends in family welfare and health indicators over time. CRS, Civil Registration System. Civil Registration System, CRS. According to the United Nations, civil registration is the continuous, permanent, and compulsory recording of vital events such as live births, deaths, fetal deaths, marriages, divorces, annulments, judicial separations, adoptions, legitimations, and recognitions. Legal basis. Civil registration is conducted under a law, decree, or regulation, providing a legal foundation for the records and certificates issued. Civil uses. Provides legal proof of identity, civil status, age, nationality, dependency status, etc., which are crucial for individual rights. Vital statistics. The information collected through civil registration offers vital statistics on a continuous basis at the national level from the smallest administrative unit. These statistics are essential for designing and implementing public health programs and conducting social, demographic, and historical research. Civil registration in India. Registrar General of India. The office was established in 1951. The Vital Statistics Department was transferred to this office from the Director of Health Services in 1960. Legislation. The Registration of Births and Deaths Act, 1969, was enacted by Parliament to enforce uniform civil registration across India. SRS, Sample Registration System. Sample Registration System, SRS. Initiation and basis. Launched by the Government of India in the late 1960s, based on a dual recording system. Methodology. Continuous enumeration. Births and deaths are continuously recorded in a sample of villages or urban blocks by a part-time resident enumerator. Retrospective survey. An independent 6-monthly retrospective survey is conducted by a full-time supervisor. Data matching and verification. Data from both sources are matched, with unmatched and partially matched events re-verified in the field to ensure accuracy. Data and coverage. Provides reliable annual data on fertility and mortality. Data are available separately for rural and urban areas at both state and national levels. Current functionality. Provides reliable annual data on fertility and mortality. Data is available for both rural and urban areas at state and national levels. Sample replacement. Sample units, villages in rural areas and urban blocks in urban areas, are replaced once every 10 years. Types of estimates provided. Fertility rates. Estimates of birth rates, including crude birth rate and age-specific fertility rates. Mortality rates. Estimates of death rates, including crude death rate, age-specific mortality rates, and infant mortality rates. Population growth rates. Estimates of growth rates derived from fertility and mortality data. Publication. Frequency. Annual publication of key findings and data. Reports. Data and findings are published in the form of reports and statistical bulletins.
NSS. National Sample Survey.
National Sample Survey, NSS. Established 1950. Objective. Launched as a multi-subject integrated continuing sample survey program for collecting data on various aspects of the national economy needed by the central and state governments. Initial focus began with data collection for national accounts, initially restricted to rural areas during its first 2 rounds. Expanded coverage, gradually extended to cover both rural and urban areas, as well as a wide range of socioeconomic topics. Survey categories: 1. Household surveys on socioeconomic subjects, e.g., population, employment, unemployment, migration, consumer expenditure, etc. 2. Surveys on landholding, livestock, and agriculture. 3. Establishment and enterprise surveys, including unorganized sector enterprises. 4. Village surveys, infrastructure facilities in Indian villages. Ad hoc surveys, conducted pilot inquiries and surveys on various topics like small and medium irrigation projects, rural electrification, and living conditions of tribals. 10-year program. NSS has developed a 10-year plan for socioeconomic surveys, focusing on 1. Employment, unemployment, and consumer expenditure. 2. Unorganized enterprises in non-agricultural sectors. 3. Population, births, deaths, disability, morbidity, fertility, maternity and childcare, and family planning. 4. Land holdings and livestock enterprises. 5. Debt, investment, and capital formation. Key details: name change. The National Sample Survey Organization, NSSO, was merged with other entities into the National Statistical Office, NSO, in 2019. Ministry, currently under the Ministry of Statistics and Program Implementation, MSPI. Publication frequency: annual. Reports on key subjects like employment, unemployment, consumer expenditure, and population. Quarterly. Some surveys, especially those related to employment, unemployment, have quarterly reports. Ad hoc. Some surveys are conducted and published on an as-needed basis.
HMIS, Health Management Information Systems.
Health Management Information Systems, HMIS, is a tool which helps in gathering, aggregating, analyzing, and using information for taking actions to improve performance of health systems. The mandate of HMIS: to ensure that there is a continuous flow of good quality disaggregated data on health of populations and healthcare services to assist in local planning, program implementation, management, monitoring, and evaluation.
AHS, Annual Health Survey.
Annual Health Survey, AHS. Origin. Concept emerged from a National Commission of Population meeting on July 23, 2005, chaired by the Prime Minister. Objective: to conduct an annual survey of all districts to be published, monitored, and compared against benchmarks. Follow-up actions. Planning Commission meetings led to the Ministry of Health and Family Welfare, MOHFW, initiating implementation. Scope: aims to create a district health profile for 284 districts in the erstwhile Empowered Action Group, e.g., states and Assam. Execution: conducted through the Registrar General of India, Ministry of Home Affairs. Launch: the survey was officially launched in April 2010. Use of vital records. Some common uses of vital records in vital statistics are: O. Preparing population estimates and projections. O. In cohort and period studies. O. Construction of life tables. O. Preparing health indicators, such as infant mortality rates, neonatal mortality rates, post-neonatal mortality rates, maternal mortality rates, etc. O. Starting points in retrospective epidemiological studies. O. Public health programs in the absence of morbidity data or for health education. O. Maternal and child health services for planning and evaluation, fertility data in family planning. So, these are some of the major sources of data in India that are important for your UGC-NET Population Studies exam preparation. If you found this video helpful, don't forget to like, share, and subscribe to the Demography Desk for more educational content. Good luck with your studies.